Exercise for Heart Health, What You Need to Know. Welcome to the U.S. Health Guide, where we bring you the most reliable and easy-to-understand health information. Today, we're diving into a crucial topic, exercise for heart health. Are you ready to learn how to transform your heart into a stronger, more efficient machine? Did you know there's a simple, powerful way to add years to your life and life to your years, especially for your heart? In this video, we'll delve into exercise for heart health, what you need to know, breaking down the science, providing clear guidelines, and offering practical, actionable tips for achieving a stronger, healthier heart. Exercise is far more than just a way to improve your appearance. It's a pivotal factor for profound internal health, particularly for the cardiovascular system. Medical professionals frequently refer to a sedentary lifestyle as the new smoking, due to its significant and quantifiable risk to heart health. This indicates that physical activity not only increases the chances of living longer, but also serves as a direct and effective countermeasure against a major current threat to health. We want you to view exercise not merely as a recreational or fitness activity, but as a crucial form of preventative medicine, an essential, non-pharmacological health intervention encouraging a more serious, consistent, and proactive commitment to physical activity. So what's the science behind a stronger heart? The heart fundamentally is a muscle. Like any other muscle in the body, it responds to physical activity by becoming stronger and more efficient. When you exercise, your heart contracts faster and more forcefully, which increases circulation and ensures a greater supply of oxygenated blood to your working muscles. Over time, this consistent conditioning means a stronger heart doesn't need to work as hard to pump blood throughout the body, leading to overall enhanced cardiovascular efficiency. Exercise confers significant physiological benefits, impacting multiple interconnected systems within the body. Regular physical activity is a powerful tool for managing and preventing high blood pressure, a major risk factor for heart disease. It also improves blood flow, even in smaller blood vessels, where dangerous plaque deposits can accumulate, and there's evidence it can even lead to the creation of new physical connections between blood vessels for more efficient circulation. Consistently engaging in physical activity helps to improve blood lipid balance, increasing good HDL cholesterol and decreasing bad LDL cholesterol and triglycerides. Exercise also plays a vital role in helping the body effectively manage blood glucose and insulin levels, significantly reducing the risk of developing metabolic syndrome and type 2 diabetes. Maintaining a healthy weight through regular exercise is crucial, as carrying extra weight puts additional strain on the heart and blood vessels. Furthermore, exercise helps reduce systemic inflammation and lowers levels of the stress hormone cortisol, offering a protective effect on cardiovascular health. By positively influencing these interconnected factors, consistent exercise dramatically reduces the overall risk of serious cardiovascular events, such as heart attacks and strokes. Statistics show that inactive individuals are nearly twice as likely to develop heart disease. The benefits of exercise extend far beyond just the heart, creating a cascade of positive effects throughout the entire body, including improvements in mental health and mood, better sleep quality, enhanced cognitive function, stronger bones and muscles, and even a reduced risk of certain cancers. So, how much exercise do you really need? For most healthy adults, leading health organizations such as the American Heart Association and the World Health Organization consistently recommend a minimum of 150 minutes per week of moderate-intensity aerobic activity, or 75 minutes per week of vigorous-intensity aerobic activity. You can combine both, and it's best to spread this activity throughout the week, for example, 30 minutes a day, 5 days a week. Moderate intensity activity means you're working hard enough to breathe harder than normal, raise your heart rate, and break a light sweat. A simple way to gauge this is the talk test. You should be able to talk comfortably, but wouldn't be able to sing. Examples include brisk walking, water aerobics, or riding a bike on level ground. Vigorous intensity activity means you're breathing hard and fast, and your heart rate is significantly higher. At this level, you'd find it difficult to say more than a few words without pausing for breath. Examples include jogging, swimming laps, or riding a bike fast. 1 minute of vigorous intensity activity provides roughly the same health benefits as 2 minutes of moderate intensity activity. In addition to aerobic workouts, it's crucial for adults to include moderate to high-intensity muscle strengthening activities at least twice a week, targeting all major muscle groups. The goal is to perform these exercises to the point where it becomes challenging to do another repetition without help, aiming for 8 to 12 repetitions per activity and trying to complete 1 to 3 sets. Examples include lifting weights, working with resistance bands, or push-ups. Remember, muscle strengthening activities should be done in addition to your weekly aerobic activity goals, not as a replacement. Even if the full guidelines cannot be met immediately, any amount of physical activity is better than none. Even light-intensity activity can help offset the serious health risks associated with being sedentary. For children and adolescents aged 6 to 17, the recommendation is at least 60 minutes of moderate to vigorous intensity physical activity daily, which should include muscle and bone strengthening activities at least 3 times a week. Older adults, age 65 and above, should aim for similar guidelines and prioritize activities that improve balance 3 or more days a week to help prevent falls. How do you make exercise a habit? The most significant improvement in mortality often comes from the simple act of transitioning from a sedentary lifestyle to incorporating any amount of regular exercise, even something as basic as a daily walk. When beginning, it's crucial to start slowly. Even just 10 to 15 minutes of activity a day can yield substantial benefits. And you can gradually build up to longer durations or higher intensity as your fitness improves. You're far more likely to consistently stick with an exercise routine if the chosen activities are genuinely enjoyable. Explore various options that appeal to you, such as dancing, walking with friends or family, joining a community sports league, gardening, swimming, or cycling. To keep your routine fresh and prevent boredom, make an effort to mix up activities. Actively look for opportunities to integrate more movement throughout your day, even in small ways. Choose the stairs instead of the elevator. Walk to a coworker's office instead of sending an email. Wash your car personally or park a bit further away from your destination to get in extra steps. You can be creative by building movement into daily chores. For instance, performing a few sets of jumping jacks or squats while waiting for water to boil, or walking in place while brushing your teeth. Make a conscious effort to break up long periods of sitting by standing up during phone calls or stretching while watching your favorite shows. To help establish exercise as a regular part of your daily routine, try to exercise at the same time each day. Consider finding a workout partner, joining a group, or involving friends and family. Having company can make exercise more enjoyable and significantly increase accountability. Set realistic goals and celebrate your successes along the way with non-food rewards. It's important not to get discouraged if you miss a day. Remember, consistency matters more than perfection. Simply get back on track with your routine the very next day. Always begin a workout with a warm-up to prepare your body and prevent injuries, and conclude with a cool-down to help your body gradually return to its normal state. Stay well hydrated throughout the day, especially during workouts. Support your exercise efforts with a balanced diet. Carbohydrates provide essential energy, while protein helps muscles recover. There are some important considerations to keep in mind. It's always highly recommended to consult a healthcare provider before embarking on any new exercise program, particularly if you have pre-existing heart conditions, other chronic diseases, or known risk factors for heart disease, such as high blood pressure, high cholesterol, diabetes, or a family history of premature coronary disease. For individuals considering high-intensity training or those with a history of heart conditions such as a heart attack or heart failure, engaging in supervised exercise programs, often referred to as cardiac rehabilitation, is strongly recommended. It's crucial to listen to your body and recognize its signals. If you experience any worrying symptoms during exercise, you should stop immediately and seek medical attention. These critical symptoms include chest pains, feelings of giddiness, dizzy spells, or blackouts, shortness of breath that feels disproportionate or unusually severe for the intensity of the exercise being done, palpitations, or an irregularly fast heart rate. For any severe symptoms, do not hesitate to call emergency services immediately. Now let's debunk some common misconceptions about exercise and heart health. Myth 1. High-intensity exercise harms the heart. Fact. When performed correctly and appropriately tailored to an individual's physical condition, high-performance exercise can actually strengthen the heart. Myth 2. If you have a family history of heart disease, exercise should be avoided. Fact. On the contrary, regular physical activity can significantly reduce your personal risk of developing heart disease, even when there's a genetic predisposition. Myth 3. Exercise should be avoided after a heart attack or if you have heart failure. Fact. Supervised exercise programs, such as cardiac rehabilitation, are strongly associated with improved outcomes for most patients with mild to moderate heart failure and after a heart attack. Myth 4. Only cardio exercises like walking or running are good for the heart. Fact. The best approach for comprehensive heart health is a balanced routine that combines cardio, strength training, and flexibility exercises. Myth 5. Too much exercise can damage the heart. Fact. The much greater risk for a cardiac event comes from sedentary individuals who suddenly engage in very vigorous exercise without proper preparation. It's crucial to progress gradually in intensity and to include adequate rest days. Myth 6. Your maximum heart rate is always 220 minus your age. Fact. While this formula provides a general average, there is wide individual variation in maximum heart rate. The key is to listen to your body. In conclusion, regular enjoyable physical activity is one of the most powerful and accessible tools for cultivating a strong, healthy heart and achieving overall well-being. Even small, consistent steps integrated into daily life can accumulate into significant, long-term health benefits, much like building a retirement account for your health. Heart health is holistic, and exercise works synergistically with other healthy habits such as a balanced diet, effective stress management, and adequate sleep. We encourage you to take that crucial first step today. Remember, every movement, no matter how small, genuinely counts towards your heart health goals. The journey to a healthier heart is continuous, and consistency and finding enjoyment in the process are far more important than striving for unattainable perfection. If this video has been helpful and valuable, please consider supporting our channel by hitting the like button, subscribing, and sharing this video with those you care about. Your support helps us share important health information with even more people. For additional resources, detailed guides, and more heart-healthy tips, please consult reliable medical information sources. Thank you for watching, and we'll see you in the next video from the US Health Guide.